Thank you for joining the IMPRO's Disparity, Cardiac Health and Cardiac Gland Data Overview. Your host for today is Melissa Ottinger. You may begin.
Good afternoon. Today we're going to be looking at benchmark report review and updates on the DASH and Cardiac Gland programs. Some brief announcements before we begin. October 18th is the DASH and Cardiac Gland Cardiac Conference. Registration is free and is open to providers and office staff. Please log on to mpro.org for more information and registration. A quick reminder that cardiac land data for quarter 7 is due on September 30th. DASH land data for quarter 3 is due on October 15th. If you require any assistance, please contact Tiara at tlovejoy@mpro.org for the cardiac land or dash@mpro.org for dash reporting assistance. If you have a pledge to live a healthier life by knowing the risk factors associated with high blood pressure, please visit the Million Hearts Initiative website and take the pledge. The DASH listserv is now live. Please log on for exciting topics and to share best practices. We also have a new consumer website, bloodpressurehealthnu.org, which is for patients and the community. Both the Cardiac Land and DASH October newsletters will be coming soon. Be sure to check out the patient resources for free community hypertension education and screening. And the DASH program did email out some provider feedback surveys, which were due on Friday. At this time, we have not received any back. If you were selected to fill out the survey, please get that completed and returned as soon as possible. I'm now going to introduce Elizabeth Waldman. She's a data analyst here at MPRO, and she's going to present an overview on the DASH and Cardiac Land data. There will be an opportunity at the end for questions, but you can always use the chat box if necessary. Liz?
Thank you. Okay, so I'll be presenting an update on both the DASH and Cardiac Land data, but because the programs report on slightly different measures, I'm going to keep the presentation separate, but the content for both will be the same. So for both, I'll be presenting on measures, time periods, do a report overview, a few notes about the data, we'll review the data, a few observations, and then ways you can use your benchmark report. So we'll go ahead and start with DASH first. These are the measures that DASH participants are reporting on. There's 5 required ones: aspirin, blood pressure control, lipid management, cholesterol management, and smoking. And then there's 2 optional measures: diabetes and BMI. I won't be talking about the optional measures today, though. These are the time periods that you're reporting on. Today we're going to focus on quarter 1 and quarter 2. I just want to point out that baseline is for a 1-year time period, while all of, obviously, the quarterly time periods are for 3 months. So we can't compare baseline to an individual quarter, but once we have 4 quarters worth of data, we'll be able to roll it up and then compare it back to the baseline. So sorry, I know this is really difficult to read, but I'll try and go through it as best I can. This is what the first page of your benchmark report would look like. At the top, it'll be your practice name. And then the second column from the left is the PQRS or NQS measure number. The next column will be a brief measure description like aspirin or blood pressure control. Then the next column is the race, ethnicity, gender categories. And then you'll have your time periods listed. So baseline, quarter 1, quarter 2, and then underneath each time period, you'll have a practice percent, which is your practice's performance for that time period, and an all practice percent, which is the performance for all practices that are part of the DASH program that have reported data for that time period. So you'll have one for baseline, quarter one, quarter two, etc. If you're part of a larger group, for instance, Clinic 18 is part of VODI along with 6 other practices, then your report's going to look slightly different. You'll have an additional column called group percent, which is the performance for the larger group for that time period. So using VODI as an example again, the group percent for a VODI practice would be the performance of all VODI practices that reported data for that time period. Then there'll be a few footnotes underneath that table you just saw previously, listing the time periods, notes about how certain data is presented, like missing and undefined values, and I'll talk about that in a little bit, and a notation for the optional measures, which is an asterisk. And then you also notice on your report that there's some colors that are popping up. The colors compare the practice percent to the all practice percent. So if your practice percent is highlighted in red, it means your practice percent was less than the all practice percent. Yellow means your practice percent was equal to the all practice percent. And green means your practice percent was greater than the all practice percent. And we didn't do any comparison between the practice percent and group percent. And then there will be a chart for each measure and time period for a total of 63 charts. But currently there's only data for baseline, quarter one, and quarter two charts. Even though you'll see all of the time periods represented, like I said, only baseline, quarter one, and quarter two will actually have data in them. So just a few notes about the data. If you see a period in your benchmark report, it could indicate one of 3 things. Your practice does not report data for this measure. Your practice has yet to report data for this measure for that time period, or the numerator was greater than the denominator. We had to remove these just because these values were throwing off the group and all practice percents. We're not entirely sure why these are popping up, though. It could be a data entry error. And then undefined values are represented by a -9. The DASH team wanted a way to differentiate between when a practice was not reporting on a measure or had yet to report on a measure, and when a practice reported on the measure but the denominator was 0. So that's what the -9 represents. And we did not suppress small denominators since many of the participating practices already have small denominators. So now we'll go through each measure, each required measure. Just a couple of notes quickly. There are 35 practices, but not all practices report on every measure for every time period. And then for each measure, we're going to be looking at performance as a percent by race, ethnicity, and sex, as well as a percent change between quarter one and quarter two by race, ethnicity, and sex. And percent change is just a comparison of 2 quantities, comparing an initial value, which is quarter one, and an after value, which is quarter two. So for measure 1, aspirin, for quarter one, Hispanic males had the highest reporting percent at 60%, while African American females had the lowest reporting percent at 19.4. Compared to quarter two, where white males had the highest reporting percent at 61.78%, and Hispanic females had the lowest reporting percent at 0. Although the denominator was very small at n = 1 for Hispanic females. So the next lowest reporting percent for quarter two was for African American males at 26.36%. I also wanted to point out African American male and female reporting percents increased between quarter one and quarter two, but they remained well below the reporting percent for white male and white females. Looking at the percent change for measure 1, other females saw the greatest increase in their percent change between quarter one and quarter two, going from 17.24% in quarter one to 50% in quarter two. African American females also saw a large increase in their percent change between quarter one and quarter two, but their reporting percent remained low at 27.91% for quarter two compared to 15.69% for quarter one. Hispanic females actually saw a large decrease in their reporting percent between quarter one and quarter two, going from 40.63% to 0%. But again, the denominator was really small for quarter two. After Hispanic females, Hispanic males saw the next largest decrease, but this group also had a small denominator of N equals 5 for quarter 1 and quarter 2. So after Hispanic males and females, white females was the only other group that saw a decrease in their reporting percent, but it was slight, going from 44.87% in quarter 1 to 44.31% in quarter 2. Looking at measure 2, which is blood pressure control, for quarter 1, white females had the highest reporting percent at 84.3%, while African American males had the lowest at 33.8%. For quarter 2, white females again had the highest reporting percent at 86.8%, while Hispanic females had the lowest reporting percent at 56.25%. Again, African American male and female reporting percents increased between quarter 1 and quarter 2, but they remained well below the reporting percent when compared to all other races. For percent change, African American males saw the greatest increases in their percent change between quarter 1 and quarter 2, going from 33.8% in quarter 1 to 52.27% in quarter 2. African American females also saw an increase in their percent change between quarter 1 and quarter 2, going from 37.18% in quarter 1 to 54.31% in quarter 2. But their reporting percent remained below the reporting percent for all other races. Hispanic females again saw a decrease in their reporting percent between quarter 1 and quarter 2, going from 69.23% to 56.25%. They were the only race ethnicity group to show a decrease from quarter 1 to quarter 2. For measure 3, lipids management, the Hispanic female rate for quarter 1 is actually missing. This is one of those instances in which the numerator was larger than the denominator. So that group was removed from consideration. For quarter 1, other male had the highest reporting percent at 68, while African American females had the lowest reporting percent at 34%. For quarter 2, Hispanic females had the highest reporting percent at 100, while African American females had the lowest at 31.82%. But again, the denominators for Hispanic male and female remain small for this measure. So if we were to remove them from consideration, other males had the highest reporting percent for quarter 2 at 69.23%. Looking at percent change for measure 3, Hispanic males saw the greatest increase in their percent change between quarter 1 and quarter 2, going from 40% in quarter 1 to 60% in quarter 2. But again, if you remove Hispanic males and females from consideration due to small denominators, other females saw the greatest increase in their percent change between quarter 1 and quarter 2, going from 50 to 58.3% in quarter 2. African American females saw a decrease in their reporting percent between quarter 1 and quarter 2, going from 36% to 31.8%. Measure 4, cholesterol management. For quarter 1, white males had the highest reporting percent at 49.62%, while African American males had the lowest reporting percent at 21.28%. For quarter 2, Hispanic males had the highest reporting percent at 60%, while African American females had the lowest reporting percent at 31.2%. All race ethnicities saw an increase in their percent from quarter 1 to quarter 2, except for Hispanic females, which you'll see in the next chart more clearly. So, African American males saw the greatest increase in their percent change between quarter 1 and quarter 2, going from 21.28% in quarter 1 to 35.56% in quarter 2. Other males also saw a relatively large increase in their percent change from quarter 1 to quarter 2, going from 30.72% in quarter 1 to 45.45% in quarter 2. Hispanic females saw a slight decrease in their reporting percent between quarter 1 and quarter 2, going from 37.5% to 33.3%. Looking at the first part of measure 5, which is smoking assessment. For quarter 1, white females had the highest reporting percent at 90.45, while African American males had the lowest at 34.8. For quarter 2, other males had the highest reporting percent at 88.74, while African American males had the lowest at 33.45. Not only did African American males have the lowest reporting percent for quarter 1 and quarter 2, but they also remained well below the reporting percent when compared to all of the race ethnicities except for African American females, which were also low when compared to all others.
I'm sorry, can everybody have their lines muted, please? There's a lot of background noise.
Looking at the percent change for Measure 5, Hispanic females and other males were the only race ethnicities that saw an increase in their percent change from quarter 1 to quarter 2. All others saw a decrease. Hispanic females saw the greatest increase in their percent change between quarter 1 and quarter 2, going from 39.19 to 75.86 in quarter 2. African American females saw the largest decrease in their reporting percent between quarter 1 and quarter 2, going from 40.9% to 38.7%. For Measure 5B, smoking counseling, for quarter 1, other females had the highest reporting percent at 59.26, while Hispanic males and females had the lowest at 0. But again, the denominators were small at 6 and 3 respectively. For quarter 2, African American females had the highest percent at 61.4, while Hispanic males had the lowest at 28.57. Looking at the percent change, African American females saw the greatest increase in their percent change from quarter 1 to quarter 2, going from 42.95 in quarter 1 to 61.41 in quarter 2. Not only did African American males and females see an increase in their reporting percent, but they were also among the highest reporting percents for quarter 1 and quarter 2. Other females saw a decrease in their reporting percent, going from 59.26 to 48.28 in quarter 2. So just a few observations about the data. Number 1, small Hispanic male and female populations. Across all of the participating practices, especially for Hispanic females, we saw small denominators for these populations. For some measures, like Measure 3, they actually had to be removed from consideration in an effort to stabilize some of the rates. For some measures, number 2, there was a noticeable difference between African American males and females and all of the race ethnicities. For some measures, like Measure 5, there was a vast difference between the reporting percent for African American males, females, compared to all of the others. There were low reporting percents across the board. So for Measure 5, we saw a low reporting percent across all of the race ethnicities. Sometimes we saw good growth on some measures and not so good growth on others. So Measure 4 saw an increase in reporting percent from quarter 1 to quarter 2 for all groups except for Hispanic females, and that would be the good. And then for Measure 5, only 2 out of 8 of the categories saw an increase in their reporting percents from quarter 1 to quarter 2. And then we would sometimes see an increase in the reporting percent, but there was still room for improvement. So for example, Measure 4 saw an increase in reporting percent from quarter 1 to quarter 2 for all groups, but the highest reporting percent for any group for quarter 1 or quarter 2 was 60%. So there was still some room for improvement with this measure. So moving on to the cardiac gland. These are the measures that you could possibly be reporting on for the cardiac gland. Just to point out quickly, Measure 2 has an optional numerator. In Measure 4, there are 2 numerators and 2 denominators. And then Measures 5 and 6 are for those that are taking part in the Governor's Award of Excellence. These are the time periods that you would be reporting on. Today we're going to focus on baseline and quarter 5. And just to review what your report would look like, at the top you'll have practice name. The second column you'll have your PQRS or NQF measure number. You'll have a brief measure description, the time period listed, and then again under each time period there's a practice percent and an all practice percent, just like with the DASH report. And then if you're part of a larger group, you'll have that extra column in there called group percent. And then there are footnotes listing each time period, a few notes about the data, and for the cardiac land, we did suppress denominators less than 5, and I'll talk a little bit more about this in a few slides. And then again, you'll see the same color coding that you saw in the DASH report. Red means your practice percent was less than the all practice percent. Yellow means they were equal. Green means your practice percent was greater than the all practice percent. And then there's a chart for each measure for a total of 9 charts. And then at the bottom, you'll see a blue shaded area, and this just offers a little more detail about the measure numerators and denominators. A few notes about the data. A period in your report could indicate one of 4 things. Your practice doesn't report data for this measure. Your practice has yet to report data for this measure for that time period. There was an undefined value or denominator of 0, or the numerator was greater than the denominator. And again, we did suppress small denominators for the cardiac gland report in an effort to stabilize the percent. So looking at the measures, just a couple of notes. There were 70 practices reporting for baseline, 55 reporting for quarter 5. Again, not all practices report on every measure for every time period, though. You have submitted data for quarter 6, but we chose not to use that today just because only 22 practices have submitted data for this time period so far. And just to point out, cardiac gland does not filter for race, ethnicity, and sex like DASH did. So looking at the data, measure 1 is showing the highest reporting percent for baseline at 68.14, while measure 5 is showing the lowest at 5.06%. Measure 4A is showing the highest reporting percent for quarter 5 at 73.98%, while measure 6B is showing the lowest reporting percent at 22.32%. Measures 5 and 6B are showing relatively low reporting percents for both baseline and quarter 5. And with the highest reporting percent being 73.98%, it looks like there's still some room for improvement across all of the measures. Looking at the percent change, measures 2A, 2B, and 5 saw relatively large increases from quarter 1 to quarter 2. Measure 2A went from 41.46 at baseline to 70.56 at quarter 5. Measure 2B went from 15.45% at baseline to 49.18% at quarter 5. And measure 5 went from 5.06% at baseline to 23.23% at quarter 5. But even though these 3 measures saw improvement from baseline to quarter 5, there's still room for improvement, especially for measure 5, which only increased to 23.23%. Measure 1 saw the smallest improvement, going from 68.14% at baseline to 69.44% for quarter 5. But this measure is one of the higher performing of the 6 measures to begin with. So again, still some room for improvement. Measures 3, 4B, and 6A actually saw slight decreases from baseline to quarter 5. Measure 3 went from 54.43 at baseline to 46.39 for quarter 5. Measure 4B went from 39.17 at baseline to 26.85 at quarter 5. And measure 6A went from 64.9% at baseline to 53.5% at quarter 5. So just a few observations. Like I mentioned, there was improvement, but there's still more room to improve. So, for example, measure 5 went from 5% at baseline to 23% at quarter 5. While we're seeing a large percent change, the reporting percent is still very low. We saw a decrease in measure performance from baseline to quarter 5 for measures 3, 4B, and 6A. Really need to focus on these measures and pinpoint why the performance decreased over time despite your efforts to improve. And some of the measures we saw slight improvement. So for measure 1, saw the smallest improvement, going from 68% at baseline to 69% for quarter 5. So again, still some room for improvement there. Just want to make sure that these measures don't become stagnant. So ways you can use your report. First, it's a way for practice to be able to assess its performance against itself, other practices, and to see if there's any improvement over time. It can provide an opportunity for learning something about your practice and how it operates that you may not have known before. It can highlight gaps or issues that a practice may be having that you were not aware of before. It can show a practice what is achievable. If you see the average amongst all the other practices, ask if you're better or worse than that. But really, it's just a great question starter. Items shown in the report may surprise you and make you ask why something is the way it is, but at the same time, the report may just confirm something you already knew. Externally, you can use it to identify trends in your own data. We saw that overall there was improvement from baseline. Again, externally, you can use it to identify trends in your data. Ask is your data showing the same trend. If not, you may need to examine further why that is. Internally, you can look at trends and see if your practice is seeing improvement over time. Maybe your practice is performing better on some measures more than others. And for practices that are part of a group, look for a difference between you and the group. Ask, what the reason might be that you're seeing the difference between your practice and the group, and should there be that variation. And I think that's it. So if anyone had any questions.
Katina, you can please open the line for questions.
Ladies and gentlemen, if you have any questions at this time, please press the number 1 key. Again, if you have any questions at this time, please press the number 1 key. There are no questions in queue at this time.
Okay, can you please post the survey question? Ladies and gentlemen, if you can please fill out the polling questions that are on the side of your screen before you disconnect. And if there are no questions and you filled out the survey, that is the conclusion of our webinar for today. Again, if you have any any questions that you think of after this, you can always email your cardiac land or DASH coordinator. And I wanted to thank everybody for joining the call today.
Thank you. There are no more questions in queue, and this concludes our conference call. Thank you.